At Swedish, we historically have had very strong clinical programs. Many of these have been leaders in our region and even beyond our region as it relates to clinical care, research, and education. One of the unique aspects of being able to support these programs is that the manner in which we deliver care is changing. In the current healthcare environment, our ability to support these programs has been more of a challenge. And this is really where philanthropy is extremely important for us to support a culture, not only a general culture, but frankly a very specific clinical culture of research, education, and real clinical care for us to be innovators as it relates to technologies and techniques and other research and education activities. How do we build a healthcare model that allows us to support that? Conventional clinical revenues have not done that. So this is where turning to philanthropy is invaluable, because it's that kind of support that allows us to explore and really ultimately implement programs that have allowed Swedish to become much more than a big regional hospital in this corner of the United States.
I think what's unique about the Swedish Heart and Vascular Institute is really the mission that it's taken. For Swedish to take on that responsibility as a non-academic institute, not a university, and say, okay, we will invest in research, we will invest in early adoption of technology, we will allow our doctors to become educators, we will allow them to travel and learn new techniques, that a hospital would have the confidence in their physicians to say, okay, here, we'll provide you that platform and you can run with it. That is very, very special.
One of the absolute critical differences of Swedish is that they have always been patient-focused. That whole philosophy has not changed at all in the 100 years. Those who are focused on delivering patient-centered care in their specialties at the highest level is what this institution has been about since the very, very beginning.
This is a goal of this institution, to really create an environment where the doctors that are here and the patients we treat are really partners in understanding that they will get the best care they could possibly get.
What we really appreciate and strive to build upon is a community where we are all participating in the delivery of care. And I think it's support of these sort of programs that are allowing us to do this. We are now functioning on the national and in many cases the international stage as leaders in particular areas because of that forward-thinking, broad-based community support as it relates to specific endeavors, whether it be with the Heart and Vascular Institute or several of the other clinical disciplines, all of which have really been leaders in their particular area.